The goal of precision medicine is to give the right intervention at the right time for the right patients. And although this is something that naturally physicians do, obviously, this also has been an acceleration given the better understanding of the cancer cell biology, the unbelievably rich pipeline and rapid discovery, and all the omics and the high throughput technology that has made the landscape very complex in oncology. Just as an example, last year there were 59 drugs approved just by the FDA. Increasingly complex landscape, pressure on the cost and sustainability of healthcare and the cost of cancer drugs. At the same time, we hear a lot about precision medicine as a buzzword or personalized medicine. There's a bit of an overlap, but we also hear some critics saying it has not delivered. I would argue that we already have started precision medicine. When you look at TKI resistance in CML, this is what we do, right? So, but now we know that many other drugs are either approved with a companion diagnostic, or we understand better that some subset of patients respond better to a drug or something else. So this increasing pressure for oncologists, given the complexity of the landscape and the number of options, makes it difficult for them to find the best option for a given patient. That's what their goal is, right? So this was the rationale for this conference last year, to start a conference that when you go to a large meeting, ASH or ASCO, you have tons of information, but we wanted to try to filter what matters, what is important to be really impactful for physicians to have a better option for their patients. And this is our second annual event. So we continue to filter down and try to, and see actually that this applies across the board. Most cancers, if not all cancers, now have something to do with precision medicine. And yesterday we had a great example, for example, from an elegant lecture from Benjamin Levy from Hopkins, looking at what's the best way to pick a targeted therapy in lung cancer, but also now emerging combination of immunotherapy, checkpoint inhibitors and others that in lung cancer give unprecedented long response and potentially the beginning of a cure. So as we refine a subset of patients, I think we'll see that precision medicine becomes reality and becomes what we need to find the best option for every one of our patients. And that's the rationale to continue this Precision Medicine Annual Conference.